One of the things that was frustrating with the entire lockdown situation was how the people that were pushing the lockdown in media and government and elsewhere made this argument originally that said if you didn't support the lockdown, then you didn't care about people dying, particularly the elderly. I and other people like me that questioned this data that said we needed a lockdown and that we needed to destroy the economy and take away people's rights thought that there was a better solution. I'd been saying since March that the solution that seemed most apt to me before we knew exactly what was going on was to first and foremost protect the most vulnerable of populations. Now, it didn't take a genius to figure out the most vulnerable population would be the elderly, particularly in places like nursing homes because they have the comorbidities we talk about, and we see with other infectious diseases like influenza that's generally the most at-risk population. So instead of shutting down the economy, we could have been putting resources into helping people at places like nursing homes by providing more testing, providing more ventilators and things like that, providing more space to make sure that they weren't all in one area where if one got infected, the rest would get infected. But we didn't. The decision to shut down was disastrous for two reasons for this population. The first reason was because we then had to spread our resources across the entire country. I'll be focusing on Pennsylvania because that's where I live. So in Pennsylvania, instead of putting almost all of our resources into these nursing homes, we're doing things like sending out the LCB to make sure that restaurants don't open up, sending out police to make sure that people aren't inappropriately walking too close together in parks and things like that. And we also have to send out financial support for all the people whose jobs we have taken away because we've had this lockdown. Now, this is despite the fact that some of these populations that we've locked down have mortality rates that are far lower than even with influenza. For example, the numbers show that for people between the ages of 0 and 17, influenza is far more likely to have severe effects or cause death than COVID-19. Yet despite that, it seems that we've locked everything down, and that requires spreading these resources, which are limited, of the Pennsylvania government to go to all of these groups. The problem with that is that means that the resources that places like nursing homes would have received if we focused on them primarily, they don't get near the amount of resources they would have. And it's even worse than that because by shutting down the economy, that means that we don't have productivity in Pennsylvania. And again, this is true of the country as a whole. With that lack of productivity means that there are less resources to go around as time goes on. If everyone was continuing to work that was healthy and able-bodied and didn't have these comorbidities, then the economy, although it would have taken a small hit, would still be in a fairly good place, which means that we would have the ability to spend that money and revenue on places with these vulnerable populations like nursing homes. But it's actually even worse than that, because it turns out that by buying into these significantly inflated models like the Imperial College model that predicted 2.2 million dead in America that we now know is a joke, that enforced the idea that we needed to keep these hospitals pristine. And so we see that the Department of Health in Pennsylvania, because of this lockdown strategy and the fear-mongering that went along with it, was convinced that they needed to keep hospitals as empty as possible for as long as possible. I told you the story of my brother who has terrible seizures, who was basically sent to a hospital, kicked out before he was feeling better after having a seizure, then had a horrible seizure 15 minutes outside of the hospital. They at one point canceled his brain surgery, saying that it was elective. It turns out the same sort of things is happening with COVID-diagnosed people in these nursing homes. They're being told, sorry, you have to stay in the nursing home because the people were afraid at the Department of Health of Pennsylvania that there would be a mass rush on the hospitals, which would mean we'd need those beds in the hospital. In effect, what occurred was this. The same people that told us, hey, if you have concerns with the lockdown, you don't care if old people die, told old people, sorry, you have to stay in these death traps that are nursing homes and die because we're concerned that young, healthier people may need access to hospital beds. That is appalling. As a result, we see that in Pennsylvania, as of Tuesday, there are over 2,600 deaths from COVID of people in nursing homes, which makes up 68% of all the deaths in Pennsylvania. And most disgusting thing about the whole thing is because the Pennsylvania government, including the Department of Health, set up these death traps telling these nursing home patients, sorry, you can't get into the hospital. Then when they predictably die in mass numbers, the Pennsylvania government then points to those deaths and say, see, we were justified in taking away your rights because all these people are dying. It's truly grotesque. Now, I want to read you a couple articles. The first is going to be from a physician who works in nursing homes in a small section. All of these will be linked in the description. So let's see what he has to say. Early on, the medical caretakers of nursing home patients found themselves at odds with other parts of the health system, as well as local public health officials. Guidance was issued with regards to visitors to nursing homes early on, but there was little precious thought from the central authorities about what to do when a resident at a nursing home got infected. As one of the medical caretakers at a nursing home, I thought it was obvious that patients who became infected needed to be rapidly removed from the nursing home. There was little doubt that the dormitory setup and significant healthcare needs of residents would make isolation almost impossible at a nursing home. If one person on a 40-bed unit got COVID, it was certain to spread like wildfire through the unit and probably throughout the entire nursing home. What I found was a local Department of Health that was laser focused on keeping patients at nursing homes. This was understandable early on because the initial epidemiological modeling and the scenes out of Italy and New York suggested local health systems could be overwhelmed in short order. In other words, the fear-mongering is what kept the Department of Health in Pennsylvania from not allowing COVID patients in nursing home to get proper care in hospitals because they bought the Ferguson Imperial College model that was garbage. Actual people died. Continuing, health systems were scrambling to build bed capacity and were worried about running out of ventilators. Again, if we would have put our resources here instead of locking down the state, then we would have had more resources for beds and ventilators. It made little sense to fill up beds in a system that was about to be overrun. The trajectory of the pandemic unfolded very differently across the country. There was New York, New Jersey metropolitan area, and then there was everything else. 2 weeks into the lockdown, Philadelphia hospitals had been emptied waiting for a New York-style surge that never came. But at this point, the nursing homes unfortunately had started to see their first infections, probably seeded from the nursing home staff. A nimble response at this point would have been utilized to the excess capacity of the hospitals and shelter the early positive nursing home patients. Hospitals had well-trained, relatively high-paid staff, adequate PPE, and negative pressure rooms. Nursing homes had lowly paid workers with a 10-to-1 patient ratio that were very poorly equipped to handle the effective quarantine scenario with a patient with COVID. But nursing home patients were treated like patients from the community who were too well to be admitted to the hospital. They were sent home. The consequences of keeping these patients at the nursing home meant the health system had to eventually deal with the entire nursing home being infected. We looked for help. We asked the Department of Health to allow us to test everyone at the nursing home in order to effectively cluster everyone with COVID in one unit. They refused because the guidelines didn't recommend this for those that were asymptomatic. We asked to utilize a large room to cohort patients with COVID. Nursing home administration and the Department of Health said this wasn't possible. COVID tests were being sent to the Department of Health and had a turnaround of about 2 to 4 days initially. I called the local large health system that had acquired a new rapid same-day test to see if we could send them tests. No answers. I spoke to a nice hospitalist at another large health system who was very receptive to the idea of boarding COVID-positive patients from nursing home in the half-empty hospital to avoid the entire nursing home eventually being infected. An email chain followed to get permission from administrative units. Absolutely not was the answer. I was told the more fruitful endeavor was to discuss advanced directives with the residents. Did they really want to be resuscitated if they got too sick? And if they didn't want to be resuscitated, did they want to go to the hospital? The implicit message, keep residents away from the pristine hospital. If they get too sick, hopefully they don't need to be resuscitated. It's sad. There's a built-in bias society tends to have towards nursing homes that at times has reminded me of a leper colony. Out of sight, out of mind. In training, I'm ashamed to say I had the same biases. I groaned when I heard the fever admission of nursing home. The patients I remembered then were nonverbal and almost had feedings, UTIs, meningitis, exams. Usually family members were scarce or unhelpful. Now, what this says is we literally sentenced these people to die. That's what the Department of Health of Pennsylvania did. They said, no, the more prudent measure, instead of getting them proper care in a hospital, would be to ask them, hey, if you get sick, do you want resuscitated? That is appalling. And it's especially more appalling when these lockdown people in places like the government, like Tom Wolf and his Department of Health, told us that if we had concerns about the lockdown, then we wanted to see old people die. This is disgusting. They knew that these nursing homes would be places that had the people that were most at risk to die from COVID. Yet they did not only nothing, not only did they not direct resources directly there, they did worse than that. They actively set up the conditions that said, no. We don't want these nursing home people to get proper care. We don't want them to be placed in hospitals because we need our clean, pristine hospitals for when the big wave hits. Why don't you instead tell them, hey, are you sure you want to be resuscitated? And put them back in the nursing home where we know that it's going to spread to the rest of the nursing home. And then they use the deaths of those people at those nursing homes to go on television every day and say, see how bad COVID is? See how many people it killed? All the while pretending they're your moral superior if you had questions about the lockdown and if you didn't want to see your livelihood destroyed by shutting down the economy. Now, the next thing I want to show you is a letter from State Representative Turzai that he wrote to the House of Representatives in Harrisburg. And this letter is just questioning the amount of deaths and things like that happened. But remember, the idea was they were afraid that these hospitals would be overwhelmed, and that's why they couldn't take nursing home patients. Let's see what he says at the bottom of this letter. Quote, according to Hospital and Health System Association of Pennsylvania, citing Pennsylvania Department of Health statistics, there are 37,000 beds in Pennsylvania hospitals. As of today, 2,572 of these beds were occupied by COVID-19 patients, which amounts to 6.95%. Now, remember what I just read you, that the Department of Health was actively telling nursing homes with infected people. Now, they know that these people in nursing homes have comorbidities and are the most vulnerable population. So when the nursing homes are pleading, please, we have people infected, can we send them to the hospitals? The Department of Health saying, no, that's not possible. You can't send them here to have them isolated. They need to stay in the nursing home, where they knew that it would spread throughout the nursing home. The logistics and the reasons for this were, well, we're afraid that the hospitals will be overwhelmed and we will run out of beds for the rest of the younger people that are more important that we want to keep safe and healthy. This was the exact opposite approach, as we know that most younger people aren't requiring ICU beds. But what's even more tragic is this prediction that they had that we would be overwhelmed turned out to be completely false. And so we sentenced people to death at these nursing homes. Well, not we, our government, the Pennsylvania government. And it turns out that only around 7% of the beds are in use. In fact, not only that, in my area, which is in Clarion County, we see that hospitals are actually furloughing employees because the hospitals are so empty. So we literally told people, sorry, you have to stay in the nursing home, setting up the conditions that we knew would lead to a widespread of the disease in these nursing homes, all on the fear that hospitals would be overwhelmed, and we have 7% capacity at hospitals. Truly disgusting and tragic. The last thing I want to show you is they talk about the importance of testing everyone. There was an article in the Post-Gazette from Pittsburgh that talks specifically about how there was an early onset plan that was never initiated by Governor Wolf and the state government, the Department of Health of Pennsylvania. And as a result, there was tragedies that resulted in nursing homes. We've seen Secretary Levine, the same person that on Tucker's show the other day showed that removed her mother from the nursing home. But at the same time, she was saying, oh, we're assuring that everyone in these nursing homes will get tests. Well, you saw from the physician's article that I put there that actually tests were few and far between. They were begging to get tests for everyone and they were told that's not possible. Now let's see what happened since these revelations have came about. In major reversal, Wolf administration says PA will begin widespread testing of nursing home residents. The Wolf administration on Tuesday unveiled a plan to begin universal testing of staff and residents at the state's hundreds of long-term care facilities, which have been the epicenter of the deaths. The announcement is a reversal for the administration, which weeks had said it did everything possible to protect nursing homes and maintained that only people with symptoms should be tested, despite the known spread of the disease from carriers with no signs of illness. Now, this shows that they'd been lying to us all along. And as you saw Secretary Levine say on the clip from Tucker last night, she said, we're testing everyone. We're doing everything possible for these nursing homes. That's the line they've been touting for over a month now. But in reality, not only have they not been testing everyone, the numbers I've seen suggest that 15% of nursing homes have been tested. And that's the ones with COVID. But not only that, they've been actively using their Department of Health to tell these nursing homes, sorry, suck it up, you have to take it. In fact, federally, Medicare is providing nursing homes 4 times as much money per patient if they keep these people in nursing homes. So we've incentivized the idea that the people that are most vulnerable to COVID have to stay in these nursing homes, knowing that it will spread throughout the nursing homes because we need to keep our hospitals pristine. Yet on the flip side, the same people, Secretary Levine from the Department of Health and Wolf, are on front of the camera saying, oh, we're doing everything we can. We're doing everything we can for the nursing homes. Oh, we couldn't test everyone because we don't have the resources. Now, all of a sudden, once it starts to become national news, they say, okay, we've changed our mind. We're going to start testing everyone that is in a nursing home facility. If they would have directed the resources from this country, allowed people to continue to work, and directed those resources uniquely to nursing homes, there would have been enough to afford tests and ventilators and proper beds and more spacing to make sure that we limited the exposure of people in nursing homes from the COVID-19 virus. But they did the opposite. And now they're using their mistake and the people that has caused to die as a reason to justify the lockdown and keeping it going longer. This is truly revolting, and this is a reason that you should never trust these people that are claiming to be your moral superiors. I clearly did not have a disregard for the elderly when I suggested that the lockdown was a mistake, that we should always question when the government wants to take our rights away, and especially if they want to collapse the economy, and instead we should fight this virus by protecting the most vulnerable populations. Yet I was told that meant that I wanted old people to die. The very smug people who claim to be my moral betters that suggested that have actually set up the conditions for old people to die in nursing homes, and they don't care. They don't care at all. They use those deaths as more evidence that we should trust them more and give them more power. This is disgusting. It's happening in Pennsylvania right now, and I bet you it's happening in states across this country. 68% of the deaths are from nursing homes. This is truly tragic. We owe people better that we knew were the most vulnerable populations. But instead, these people didn't care about the elderly. They were more concerned about keeping their fear-mongering going and the idea of having empty, pristine hospitals. Hey, if you like this video, please like and subscribe. I'll be putting more videos out daily. Please share this video with other people. I'd really appreciate it because I think this is a story that needs covered because the elderly are being lost in this equation and they're just being tossed away and said as necessary victims of COVID in order for Governor Wolf to achieve his power grab. Thanks so much, everyone, and have a good one.